Hi, this is Dr. Story. Thought I would update people on our local coronavirus or Delta experience, and then also discuss treatment options as they're continuing to develop. First off, I've been receiving quite a few questions from people regarding the news that seems to be being published and spread all over the United States that Idaho is in a lockdown at capacity type circumstance. And that's a fascinating piece of news. It actually is a little more nuanced than the kind of clickbait version that we're seeing. First off, I'm going to include some links here after at the end of our video that you can go look at the actual data for our hospital circumstances. We are experiencing high levels of Delta, and we've experienced quite a few people being hospitalized with it. Some of our larger hospitals that we refer to, including Sacred Heart in Spokane, St. Luke's down in Boise, and Kootenai Hospital in Coeur d'Alene, have been at near capacity for the last several weeks, but that's actually beginning to turn a corner. Locally, we've actually seen our local hospitals continue normal operations and stay below 60% for their hospitalization rates as far as capacity. And that's actually been really unique and an interesting thing to watch. If you also look at the data across the United States, once again, we seem to be cresting a wave, and I'll include that data, and that's fantastic to see. It seems to be mirroring previous waves of coronavirus, and the Delta variant seems to be following a very similar pattern, and it's a hopeful pattern. It certainly is pressing, and we have a lot of medical staff that are quite exhausted. It also seems to be stoking significant anxiety for people, and I understand. Delta is a bit more severe. It's more contagious. It also seems to be coming smack into people coming back to school, and frankly, exhausted of masking and exhausted of being social distance and exhausted of being told to stay at home and really resuming normal life and being exposed. And we're seeing Delta basically find the edges of people who have not been exposed previously and not been vaccinated. That is an interesting problem, and there's a lot of people asking the question, is it really the pandemic of the unvaxxed? It is not, and it is. Please see my previous podcast on cross-politic, where I discuss the challenges of vaccinated immunity versus natural immunity, and some recent data that shows that it's not as good as we thought, but it definitely is protective, and it also gives some context for safety and risk when it comes to considering coronavirus vaccination. Really what we're seeing is that people who are hospitalized are by and large unvaccinated, and it's also people who are a bit younger. Part of that is it's hitting a much larger portion of the population than the original coronavirus did. We're also, however, seeing a significant amount of spread because the coronavirus vaccinations are not keeping people from getting the illness, and they're not keeping people from spreading it. Now, it's a pretty blunt statement, but it's an accurate one. We know that people who have the vaccine do get the illness, and they actually carry virus at about the same level as people who are more symptomatically or obviously sick. And they may not even know it because they're not necessarily sick enough to go consider getting tested, and they may be under the impression that they can't get coronavirus, but that's not true. As to being overrun, we're also seeing a significant turn, and it continues to be the case that now 18 months into coronavirus, the risk of dying of coronavirus is very, very low. That continues to be the case. We are seeing a bit more cases in the middle age where people are having it longer and a more difficult case, but we're also treating coronavirus very differently. All right, one of the things that we are doing, and that's unique and that's come out in the last couple of weeks, is something called monoclonal antibody therapy. It's now widely available. We have it at both of our local hospitals. It is limited to people who are considered high risk. High risk is defined as people who are greater than age 55 and have significant health issues such as morbid obesity, significant lung diseases, or immune compromised states. That means something like a rheumatoid disease where you're on a daily suppressant medication. Still, the people who are at highest risk are the very elderly, and that has been the case all along. Why we're seeing mostly non-vaccinated patients being hospitalized is by and large many of the 30 and 40-year-olds took a look at coronavirus when it first came through and accurately looked at it and said, this is probably not going to be a health risk for me. I probably don't need to vaccinate. And so now as Delta is making its way through, it is catching those people. Let's also talk about what to expect. So if you have had the vaccine, if you've had coronavirus before, you should expect that you may get sick again. And that's consistent with viral patterns. As they change year to year, as they mutate, it's very similar to another pattern that we understand, which is influenza illness. Influenza seems to have a new strain each year, and if you've had influenza in the past, you're less likely to be getting a severe case of it, or if you've had the vaccine, you're less likely to get a severe case of it. But you do tend to get a new strain each year, and that strain causes new illness. And Delta is very similar that way. It is causing illness in people who've been vaccinated or have had natural immunity. But you're likely to get an illness that's so mild that you don't know it. It's likely also to pass through your system in a quick way. Here's what I would advise. If you are not feeling well, if you have a low-grade fever, if you feel under the weather, aches, fevers, mild headache, shortness of breath, sore throat, gut issues, and they just come on suddenly, please stay home. Wash your hands, limit your contacts, be neighborly. It really is about the only way to slow this down. And thankfully, most people that have Delta are symptomatic and don't know it. Are symptomatic and know it. And so it can take appropriate actions. If you are, in most cases, you're going to overcome that illness on your own. And by and large, after a couple of days, it'll be passing and you'll move beyond an infectious circumstance, not only feeling better, but minimally likely to continue passing it on. If you are, however, never seen coronavirus in the past, you haven't had the vaccine, it's likely you're going to have a longer, more drawn-out illness. And what we're seeing is about a 10 to 14-day illness and then several weeks of recovery before you're back to yourself. For some of those folks, we've been trying steroid therapy, and that has some good indications, both inhaled and by mouth and even intranasal, and yet still people are having a long, drawn-out course. The ones that we get most concerned about are those people that have significant illness at about 7, 8, 9 days, and they get a real heavy chest, bloody sputum. That's an opportunity then to check in with your family physician and talk about oxygen levels, perhaps some labs and a chest x-ray, and see if you actually have a pattern that would suggest worsening and a more aggressive treatment response. Last, I would say a little talked about issue that is important is that one of the main risks and complications of coronavirus is what's called hypercoagulability. What that means is that your blood just sticks together much more, and you're at risk of clots, heart attacks, strokes. That risk actually hangs over you for about 6 weeks after you have coronavirus. Thankfully, it kind of dissipates after that. There's good evidence that using a daily aspirin in that circumstance, and even something as small as the 81 milligram, can make a significant difference. And so we're talking to our patients about that, and I'd encourage you to talk to your physician about it as well. Again, I've included some links, and I'd encourage you to be well informed. Don't be fearful, but be well prepared. Continue talking to your family doctor if you contract an illness, and be kind if you do get ill. Please stay home.